For many decades now, across clinics in Tokyo, Kyoto, and Okinawa, Japanese longevity physicians have observed the same pattern in aging bodies. Strength fades long before movement disappears. And yet, in the United States and Canada, where many of our viewers live, modern wellness advice continues to insist that walking is enough. Walking is gentle, accessible, and familiar, so it becomes an easy recommendation. But for those of us who have spent over 40 years in rehabilitation and orthopedic practice, watching thousands of women and men navigate their late 70s and beyond, we know that walking alone cannot restore what time has taken. It cannot rebuild muscle fibers that have already weakened. It cannot retrain the stabilizers that quietly disappear as balance declines. It cannot strengthen bones, because there is no load challenging them to adapt. And it cannot sharpen the rapid postural reactions that protect older adults, especially older women, from devastating falls. Aging is not only about movement, it is about resilience, how the body responds when life surprises you. This is why, several years ago, a group of experienced Japanese orthopedic specialists and rehabilitation doctors began a joint review of what truly restores strength after age 75. We examined studies from 9 countries, interviewed colleagues from around the world, and tested 197 different exercises ourselves, including 140 for traditional Japanese movements used in fall prevention programs for older adults. Most exercises offered small benefits. Some offered none. But 5 movements rose far above the rest 5 that consistently restored strength, stability, and reaction time even in seniors well into their late 70s and early 80s. They were not intense, they were not complicated, but they activated the deep systems of the body that walking simply does not reach. And today, we begin with number 5, a movement almost no senior practices, yet one that instantly reawakens a form of balance that becomes quieter with age. Heel-to-toe walking, known in clinical practice as tandem walking, may look simple from the outside, but inside the body, something remarkable happens. This movement directly trains proprioception, the sense that tells your brain where your body is in space even when you are not looking. It is what allows you to step backward without seeing the floor or reach for a cupboard without losing balance. After age 75, proprioception declines quickly because the nerve signals traveling from the feet to the brain become slower and less precise. Women, especially those with age-related bone density changes, feel this decline earlier because their stabilizing muscles weaken faster. A study from the University of Pittsburgh found that proprioceptive accuracy can drop by nearly 25% between ages 65 and 80. This means the brain receives weaker information, leading to hesitation, shakiness, and a subtle fear of walking in unfamiliar places. Heel-to-toe walking forces the body to pay attention again. When you place one foot directly in front of the other heel touching the toes of the opposite foot, you create a narrow base of support. Suddenly, the brain must sharpen its awareness of alignment, pressure, and micro-corrections. Each slow step becomes a message sent to the nervous system. Wake up, adjust, stay steady. And this awakening does not happen during regular walking on flat surfaces, because walking allows the hips, ankles, and core to drift into autopilot. Tandem walking breaks this autopilot and repairs communication pathways that aging slowly quiets. To practice heel-to-toe walking safely, begin beside a wall or sturdy countertop. Many older women in our clinics say that even just having the wall nearby makes them feel more confident, and confidence itself improves balance. Stand tall with your shoulders relaxed and your gaze focused on a point straight ahead. Then take one slow step, placing your heel gently against the toes of your back foot. Try to feel the pressure along the outside edges of your feet and the subtle engagement of your core. As you shift weight, move slowly, allowing your body to correct itself. Aim for 20 steps in a straight line and repeat this routine twice a day. You may notice your ankles wobble slightly at first. This is not a sign of weakness, it is a sign that your stabilizer muscles are waking up. In an 8-week clinical program published in the Archives of Physical Medicine and Rehabilitation, older adults practicing heel-to-toe walking improved their dynamic balance by 19%. Many participants reported something far more valuable than numbers they felt steadier in grocery. Store aisles, more confident crossing parking lots, and less fearful walking into unfamiliar buildings. These are the kinds of changes that restore independence, especially in women who often carry both physical and emotional responsibilities through their households and families. As you become more comfortable, you can gently progress the exercise. Try turning your head slowly, side to side as you walk. This trains your brain to remain steady even when your vision changes. Or, if you feel safe, close your eyes for a single step to challenge your internal sense of alignment. Each variation strengthens a different layer of your balance system. In Japanese longevity medicine, we teach that balance is not a single skill, but a tapestry woven from muscle, nerve, joint, and breath. Heel-to-toe walking reminds these parts how to speak to each other again. Before we move to the next exercise, I would love to hear from you. How old are you, and where are you watching from? Our community now includes many viewers across the United States and Canada, especially women who tell us how these practices have helped them feel more stable and confident. We read every comment because your stories guide the work we do here. Now, let us continue with number 4, an exercise that determines whether you will maintain independence through your late 70s and beyond. As we move deeper into this list of essential movements for adults over 75, there is a reality we must acknowledge with honesty and compassion. The ability to rise from a seated position without using the hands is one of the strongest predictors of whether an older adult will remain independent. In Japan, we observe this every day in our longevity clinics, and it mirrors what women across the United States and Canada experience silently in their homes. A chair may look simple, but it becomes a quiet measure of strength, confidence, and mobility. The muscles responsible for standing, primarily the quadriceps, glutes, and deep core, begin to lose mass rapidly after 75, especially in older women whose baseline muscle reserves may be smaller. This is why standing up from a chair can transform from an effortless motion into something that requires planning, momentum, or even fear of falling forward. Walking cannot correct this loss. Steps do not load the quadriceps enough to rebuild strength, nor do they challenge the glutes in the way required for maintaining stability when rising. This is why the chair squat is one of the 5 movements Japanese orthopedic physicians consistently recommend for restoring strength after 75. It is simple and deeply functional, mirroring one of the most frequent movements in daily life, getting out of a seat. And yet, it is often overlooked because people assume that if they can walk, their legs must be strong enough. But these two abilities are not the same. To perform the chair squat properly, begin by sitting in a sturdy chair with a firm seat. Your feet should be flat on the floor and placed about hip-width apart, with your toes pointing slightly outward, just enough to allow the hips to open gently. Crossing your arms over your chest helps keep the movement honest. Placing your hands on your legs makes the motion easier but reduces the strength-building effect. As you prepare to rise, lean forward slightly from the hips, not from the spine, and shift your weight toward your feet. This forward lean is not a cheat. It is the body's natural strategy for centering balance before lifting. When you push through your heels, you activate the posterior chain, the deep muscles that keep you stable. As you rise, keep your movement slow and controlled. A 3-second ascent engages far more muscle fibers than a quick, momentum-driven stand. Once standing, pause for a moment to feel the alignment of your hips and knees. Then slowly lower yourself back to the chair, again over 3 seconds, aiming to barely touch the seat before rising again. The downward phase is where much of the muscle rebuilding happens. This is true in Japanese rehabilitation centers and in Western orthopedic research alike. A study from Tufts University found that seniors performing chair squats 3 times per week for 12 weeks increased leg strength by 28% and improved stair climbing ability by 22%. But beyond statistics, what matters most is how women describe their experience, feeling steadier in the bathroom, more confident getting out of the car, less anxious when standing from a low sofa. These are the moments where independence is either preserved or quietly slips away. If rising without using your hands is too difficult for now, begin by pushing off the armrests lightly reducing the assistance each day. Some older women begin by elevating the chair slightly with a cushion, gradually lowering it as strength returns. Once the movement becomes easier, you can progress by holding a light object against your chest or pausing longer at the bottom of the squat to increase muscle engagement. In Japanese practice, we teach that strength is not about intensity, it is about consistency and progression. Now we turn to an exercise that addresses something walking can never train: the ability to stabilize the hips when balance is threatened. At number 3, we have standing hip circles, one of the most underrated movements in senior health. Hip mobility declines sharply between ages 65 and 80, and this decline affects women more severely due to natural changes in pelvic alignment and bone density. A stiff hip cannot pivot to catch you during a stumble, nor can it adjust when stepping sideways on uneven ground. Standing hip circles strengthen the small stabilizing muscles around the hip joint, muscles that are rarely trained in everyday life. These include the hip abductors, rotators, and deep gluteal muscles. A study from the University of Maryland found that weakness in the hip abductor muscles was the strongest predictor of falls in adults over 70, even stronger than leg strength, even stronger than balance test scores. When the hips lose their strength and flexibility, reaction time slows, and the body cannot correct itself quickly enough during a trip or slip. To perform hip circles, stand beside a counter or wall, lightly resting one hand on it for balance. Lift your outside knee to a comfortable height. It does not need to be high. What matters is the controlled movement that follows. Slowly move your knee out to the side, then sweep it behind you, then return it to the front, creating a smooth circular motion. Your standing leg will work harder than you expect, stabilizing your entire body as the lifted leg moves through space. Perform 5 slow circles in one direction, then 5 in the opposite direction before switching legs. Each circle should feel deliberate and steady, as though you are drawing a large circle on the air. A clinical trial published in Age and Aging showed that seniors who practiced hip mobility exercises for 10 minutes per day improved lateral stability by 31% over 3 months. Reaction time also improved by nearly 20%, meaning the body became faster at correcting missteps. Many of our female patients in Japan describe hip circles as a gentle awakening in the morning, helping their joints feel smoother and more coordinated throughout the day. Walking only moves the hips forward and backward. Hip circles restore full 3-dimensional mobility. Perform this exercise in the morning and again before bed when the joints may feel stiff from inactivity. Over time, you may notice not only improved stability, but also less discomfort in the lower back, as hip mobility directly reduces compensatory tension in the spine. Now we are ready to move on to the final 2 exercises movements that protect the entire trunk, restore deep strength, and retrain the nervous system to respond with speed and stability. These may be the most important practices of all for aging well. As we reach the final 2 exercises in this sequence, we focus on movements that go deeper than muscles alone. After age 75, the body begins depending heavily on the strength of the trunk, the chest, shoulders, abdomen, and deep spinal stabilizers to stay upright and safe during unexpected movements. Walking offers little challenge to these systems. Steps do not train rapid bracing reactions, nor do they teach the body how to stabilize under sudden force. And this is precisely why the isometric wall push, number 2 on our list, is so essential. It is one of the most overlooked exercises in Western senior fitness, yet in Japan, physicians recommend it frequently because it strengthens the entire kinetic chain without requiring joint movement. This makes it safe, accessible, and especially effective for older women who may experience discomfort during traditional resistance routines. When you push into the wall with your full intention, even though the wall does not move, your muscles generate real force. This is called an isometric contraction. Your body works, but your joints remain still. Isometrics are uniquely powerful because they train the nervous system to activate multiple muscle groups together. After 75, this coordinated activation declines, making it harder for older adults to brace themselves during slips, unexpected bumps, or even when reaching forward quickly. A study in the Journal of Applied Physiology showed that isometric training increased muscle force production by 35% in adults over 70, compared to 22% from traditional resistance training. Most importantly, the ability to produce force rapidly, the key skill that stops a fall, improved by 40%. To practice the isometric wall push, stand facing a wall at about arm-length length distance and place both palms flat on the surface. At shoulder height, relax your shoulders, lengthen your spine, and engage your core by gently drawing your belly inward. From here, push into the wall with steady, growing effort, as though you are trying to move it forward. Your arms, chest, and shoulders will fire immediately, but so will your core and legs as they stabilize your frame. Hold this push for 10 to 15 seconds, breathing normally throughout. It is important not to hold your breath. Gentle breathing allows the muscles to sustain the contraction without strain. After resting for a short moment, repeat 3 to 5 times. Older women often notice something subtle yet powerful during this exercise. The feeling of everything working together. The arms, torso, hips, and legs begin communicating again, aligning themselves to support the push. This is the same whole-body integration required to prevent falls. When someone stumbles, the chest tightens, the core contracts, and the legs brace within a fraction of a second. The wall push trains this pattern safely, without requiring sudden movement or heavy resistance. Variations are simple: pushing into a countertop, a sturdy table, or even the arms of a chair while seated can offer similar benefits. What matters most is the intensity of the effort. You choose how hard to push, and this makes the exercise adaptable for any strength level. Now we arrive at the number one exercise, the single most important movement. Japanese orthopedic doctors recommend for adults over 75. It is simple, quiet, and requires no equipment. Yet it integrates everything the aging body needs: balance, proprioception, hip stability, core activation, and ankle strength. This movement is the single leg stance. Standing on one leg seems too basic to matter, but research tells a different story. A landmark study in the British Journal of Sports Medicine, which followed more than 1,500 adults over 70 for a decade, found that the inability to stand on one leg for 10 seconds was associated with a significantly increased risk of mortality, but beyond lifespan. What truly concerns us in clinical practice is fall risk, and here, the single leg stance is unparalleled. A study from Germany found that practicing this simple movement reduced falls by 43% in adults over 75. Nothing else in the study came close to offering the same protection. The reason is straightforward. Every step you take is, in truth, a single leg stance. Walking is a series of weight transfers where one leg must support the entire body, while the other swings forward. After 75, especially for older women whose hip stabilizers weaken faster, the body begins to rush through this phase, spending less time balancing on each leg. This reduces stability and increases the likelihood of missteps. Practicing the single leg stance restores the strength, alignment, and reaction time needed to walk safely and confidently. To perform this exercise, stand near a wall or countertop. Shift your weight onto one leg and gently lift the opposite foot just an inch or two off the ground. It does not matter how high the leg lifts. What matters is the quiet stillness of the standing leg. You may feel slight wobbles in the ankle or hip. This is your stabilizer muscles reawakening. Try holding the stance for 10 seconds at first, then slowly work toward 30 seconds. Switch legs and repeat. Perform this exercise 2 to 3 times per day, ideally during moments already built into your routine while brushing your teeth, waiting for the kettle to boil, or standing at the kitchen counter. These tiny windows of practice accumulate quickly. As strength improves, you can progress by turning your head gently from side to side, closing your eyes for a brief moment, or standing on a soft surface like a folded towel. Each variation strengthens different layers of your balance system. Many older women in our clinics describe a renewed sense of confidence after practicing single leg stance for just a few weeks. They feel steadier reaching overhead, stepping into the shower, or navigating crowded public spaces. These are the quiet victories that preserve independence. Now that we have explored all 5 exercises, it becomes clear why walking alone cannot meet the needs of an aging body. Walking is beautiful and beneficial, but it does not restore lost muscle, strengthen the hips, retrain proprioception, unify the trunk, or rebuild single leg stability. The good news is that these 5 exercises require less than 15 minutes per day and can be performed safely at home. They form a complete system awakening balance, restoring strength, and helping adults over 75 move through the world with greater confidence and security. Before we conclude, I would love to hear from you. Which of these movements feels most important for your body right now? And for those of you in the United States and Canada, especially women in your 60s, 70s, and 80s, your shared experiences help others find courage to begin. Tell us what challenges you are facing and what improvements you hope to see. We read every comment with care. Thank you for watching and for taking this time to care for your body. Aging may change us, but with the right movements, we can stay strong, balanced, and beautifully capable at any age.